HighBridge, a division of Recorded Books, presents Sexually Speaking, What Every Woman Needs to Know About Sexual Health by Dr. Ruth Westheimer, Amos Grunebaum, M.D., and Pierre Lahou. Read by Rebecca Gallagher. Disclaimer: the information contained in this book is not intended to serve as a replacement for professional medical advice. Any use of the information in this book is at the reader's discretion. The author and the publisher specifically disclaim any and all liability arising directly or indirectly from the use or application of any information contained in this book. A healthcare professional should be consulted regarding your specific situation. Preface. When clients come to my office for sex therapy, very often I must send them to see a medical doctor first to rule out any physical causes for their problems. If the client is a woman, I send her to see her gynecologist. I've always looked at women's sexuality as a team effort between my work and that of the medical community. In this book, I get the chance to demonstrate what such a team can do. Luckily for me, my co-author is a doctor who considers it an important part of his care to ensure that his patients' sex lives are fully functional. Dr. Amos Grunebaum and I are old friends, and we get along so well, not just because we both hail from Germany, but because of our understanding that optimal sexual functioning is an important component of a woman's overall health. Sadly, not every gynecologist makes the same effort that Dr. Amos does with regard to sexual functioning. Because of this, women need to have a better understanding of what to expect when going to a gynecologist for both their physical and their sexual well-being, so that they can get the help they require. I've always regretted that because of the Nazis, I never got to fulfill my dream of becoming a medical doctor. Yet, although I admire doctors, I've had my share of those who've given me the wrong advice. Doctors aren't perfect, and the various pressures they now face can make it even more difficult for them. This is why every woman needs to take more responsibility for her own health. I have visited a gynecologist many times, and I didn't always have the information I needed to ensure that I was getting the very best care. In preparing this book, I've learned a lot about what these visits can offer, so I know my listeners will as well. Whether you currently have a problem with your sex life or are simply interested in getting the most from your visits to the gynecologist, I hope that you and every other woman will want to have this book as a resource. Dr. Ruth Westheimer. My practice is based in one of the best hospitals in the world, New York Hospital Cornell University Medical Center in Manhattan. We offer women the most up-to-date and effective technologies for their gynecological care. If I need to refer a woman to a specialist, one of the best doctors is probably working just down the hall. Of course, I realize that not every gynecologist has access to this type of facility, and it's the patients of those doctors who need this book the most. If you're sure that your medical issue is fairly routine, then you can usually trust that you are getting adequate care. Yet, if you don't know how to ask questions and what questions to ask, you might fall into a situation where you require the best possible care but aren't getting it. It's not necessarily the doctor's fault. It's difficult to suggest to patients that they travel hundreds of miles to get medical care when quite possibly it wouldn't make a difference. A doctor needs to have confidence in his or her skills and in the available facilities. It's up to patients to seek out the information they need so that they can make informed decisions. There is, however, one area of a woman's health that could use improvement in hospitals, big and small: the Victorian attitude The idea that sex is something to be buried under the rug is much stronger in this country than in my native Germany. For me, it is natural to talk to my patients about their sexual functioning, though I must admit that some are embarrassed when I first open up this line of questioning. Yet, because I am in charge of helping women with their pregnancies, which of course could not happen without sex, I see no reason not to treat sex as an important component of a woman's total health. Dr. Ruth and I collaborated on another book, Dr. Ruth's Pregnancy Guide for Couples, and that was quite a satisfying experience for me. Here, we get to broaden our scope, covering every aspect of what a gynecologist has to offer his or her patients, and I hope that together we will change the attitude of women all across the country with regard to how they view their relationship with their gynecologists. Amos Grunebaum, MD. Introduction. Once upon a time, a woman went to see her doctor. She was greeted by a smiling man who took his time when examining her. When she left, she was absolutely sure that he had everything under control, and she didn't have to worry about a thing. This isn't the opening line of a fairy tale, but the way the doctor/patient experience used to be not so long ago. This isn't to say that serious medical issues were always treatable, but one's health was put into the confident hands of a doctor, and that was that. The idea of questioning a doctor would never have occurred to a patient. Doctors were looked on as if they were gods who knew all there was to know. Not only have there been tremendous medical advances since those days, but many other changes have taken place, such as women having the choice of seeing a male or female gynecologist. Most of these changes have improved the doctor-patient relationship, but, as we all know, with progress comes responsibility. Now, individuals need to be responsible for knowing a lot more in order to get the most out of our modern healthcare system. Helping women get optimal care when they see a gynecologist is the aim of this book. One major change that took place is the near disappearance of the GP, the general practitioner. Yes, GPs still exist, but these days, unless you are dealing with the common cold, you're likely to be sent to a specialist at the drop of a hat. On one hand, that can be a good thing, because a specialist really knows his or her stuff. On the other hand, when you're seeing a myriad number of doctors, you can get lost in the shuffle. For women, however, that doesn't have to be the case. Your gynecologist is equipped to deal with many of the medical issues you might encounter, and if you hunt around, you can find a gynecologist who will supervise your overall health. An important goal of this book is to help you stop categorizing a gynecologist as only a doctor who deals with down there, but rather as a woman's doctor who can guide you in a variety of ways. One area that women need medical help with is their sexual functioning, and their gynecologist should be their first line of support. Yet, because sex is an embarrassing subject, this area often gets neglected. Even worse, some women never go to see a gynecologist, or they wait until it can't be put off any longer because they feel too embarrassed or uncomfortable exposing their bodies. Routine care is important to prevent and treat problems before they develop into more serious issues. Together, we hope to explain not only what a gynecologist can do for you, but also how you can get over your fears and integrate yourself into the process in order to get the most from your visits. Just remember that our advice has to be general in nature. When a doctor sees a patient, dozens and maybe hundreds of factors must be weighed. A major lesson of this book isn't which treatment you should get for a particular medical issue, but rather how to get the best possible treatment from your medical practitioners. We want to give you the confidence to demand the best possible care, so you have to be armed with enough knowledge about what constitutes good medical care. That's what you'll get in this book. The other important lesson we want to pass on is that your gynecologist can offer you much broader care than simply for your female anatomy. Gynecologists receive well-rounded medical training and can handle many of your health-related needs. This is another reason that it is important to develop a good relationship with your gynecologist. You should be able to rely on him or her to maintain your overall health. Certainly, there are situations where a specialist has to be called in, but once you establish a solid rapport with your gynecologist, you'll have a valuable ally. If you have a significant other in your life, then you know that while sex isn't the only basis for your relationship, sex can strengthen that bond. Similarly, by opening up to your gynecologist regarding the sexual aspects of your health, you'll form a bond that can serve you well. Yes, you may be embarrassed to reveal that you have problems in your sex life, but once you do, you'll be on the road to having not only the best sex possible, but also the best medical care overall. 1. How to have a happy, healthy sex life. Probably more people are having some sort of sexual difficulty on any given day than have the common cold. Yet good information about a problem related to sex is so much more difficult to obtain. In this chapter, I'll give you some basic tips on how to have a happy, healthy sex life. I've been writing about sex for some 30 years now, and so many people have told me how I've helped them improve their sex lives. Here's hoping I can do the same for you. Sadly, too many doctors in the United States are not given the proper training in talking about sexual matters with their patients. They don't learn it in medical school or during their training as gynecologists. We seem stuck with too many prurient attitudes left over from the Victorian era. So instead of simply considering sex a part of our daily lives that deserves the same attention as any other bodily function, we act as if sex is shameful and something not to be discussed, even with a doctor whose field includes all of the organs involved in proper sexual functioning. As you know, I talk about sex from morning till night, and have been doing it publicly for more than a quarter of a century. Yet, even I still get embarrassed sometimes. From time to time, I have to force myself to say the words vagina, or orgasm, or masturbation. In fact, when I give a lecture, I usually get the audience to say those words out loud because it helps break the ice. So I fully appreciate the reticence that a doctor might have about the subject of sex, and I certainly understand any embarrassment you might feel. Yet while most people get sickened at the sight of blood, doctors learn to get over such feelings, and surgeons can cut open a body without thinking twice about it. I don't blame doctors for their lack of training on sex, but I do blame the medical establishment, which doesn't offer the proper training to young doctors. Although I've been calling for doctors to have more training for many years now, even when I do grand rounds at hospitals and speak to the doctors, young residents still tell me that the training they get in the area of sex remains lackluster, to put it gently. You could potentially excuse this state of affairs by saying that the lack of sexual knowledge isn't life-threatening, and as long as a couple can reproduce, it's just not that important, and so not an area that doctors need to cover very thoroughly. But you'd be wrong, because of course sex is important. It's part of the glue that holds a relationship together. A sexless marriage is not a stable one. If you're in an unhappy marriage, you'll be under a lot of stress, and stress has definite negative consequences on your health. Sexual problems can also make it more difficult to actually form relationships. Both men and women who have sexual problems may find themselves alone, and although being single is not life-threatening either, it certainly affects the quality of your life as much or more than many other illnesses. How many people would give up having a life partner in exchange for getting rid of their hay fever, for example? If people think sex is important, then so should the medical community. Then there's the question of sexually transmitted diseases, STDs, which can not only do great damage to your body, but can also be life-threatening. If doctors are not involved in their patients' sex lives, then whatever message they try to pass on regarding STDs will not get through. If patients are afraid to talk about sexual matters with their doctors, they may not bring up STDs either. STDs, without a shadow of a doubt, affect a gynecologist's practice. To give but one example, it is vital to know whether a pregnant patient has herpes. Although I shouldn't need to prove that good sexual functioning is important and should be assisted by the medical community, there is no escaping the fact that as a whole, women do not get the support they need because the topic of sex continues to be one that doctors are not properly trained to handle. While in some instances it helps if the gynecologist is a woman, just the fact that a female doctor is speaking to a female patient does not ensure that good communication about sex is taking place. In fact, some women may feel more comfortable talking to a male doctor about certain issues, including sex. Patients could help change this situation. If doctors were faced with daily questions about sexual functioning, they would get used to answering them, and they would study the sexual issues they were being asked about. Yet patients also feel embarrassed, so they don't raise the questions they have about sexual functioning. This combined embarrassment of both doctors and patients makes the topic so rarely part of the doctor-patient relationship. Hopefully, by listening to this book, you'll have a better idea of what to do to get the help you need from your doctor. If you are a doctor listening to this book, maybe you will learn to change the way you handle your patient's sexual problems. The door of communication between patient and doctor can't be opened until patients have a good understanding of their own sexual functioning. So that's what I'm going to tackle first. Orgasm. Because it is required for a man to have an orgasm in order for our species to reproduce, evolution has made certain that most men don't have a problem in that department. But a woman can get pregnant without ever having an orgasm, so it is far more common to find women who encounter difficulties when trying to achieve sexual satisfaction. Yet the very fact that women can have orgasms, even though these are not needed for reproduction, tells you that orgasms are important to a woman's well-being. The clitoris is the seat of a woman's potential to have an orgasm, and the fact that every woman is born with a clitoris means that every woman should be able to have an orgasm. While on rare occasions there are women who cannot have orgasms because of some physical reason, most often a disease, such as diabetes or severe depression. For the most part, the two main causes of a woman's inability to have an orgasm are either ignorance or psychological problems, or a combination of the two. Both of these factors are well within the purview of a gynecologist's expertise. We've all seen couples making love in the movies. The man is on top of the woman, and the two are thrusting at each other, both having tremendous orgasms. If a couple bases their own lovemaking on what they've seen on screen, they would assume that both partners would always have an orgasm from intercourse in the missionary position, that is, with the man on top. Now, some couples can do this, but the majority of women do not get enough clitoral stimulation from this type of intercourse to have an orgasm. As a result of this mistaken belief, in millions of bedrooms, couples are having sex and the woman is not having an orgasm. Because so many women blame themselves for this situation, thinking that they are deficient in some way, they end up faking orgasms, which guarantees that non-orgasmic sex life will continue forever, or at least as long as the woman is with this particular partner. The cure for this situation is simple. Some women will become sufficiently aroused from foreplay, by which I mean manual or oral stimulation to her clitoris, along with other caresses and kisses before intercourse, to actually have an orgasm during intercourse. Other women need continuous direct physical stimulation to their clitoris in order to have an orgasm, and this can be done either before, during, when using positions other than the missionary, or after intercourse by her partner using his fingers, his mouth, his big toe, or a vibrator. Some women cannot figure out what exact sensations they need to have orgasms with a partner. In fact, they may need to concentrate so much in order to become sufficiently aroused that they can only have an orgasm alone via masturbation. And for some, masturbation must include the very strong sensations of a vibrator. Many of these women can then teach their partners what to do, although a small percentage end up being able to have an orgasm only by themselves, because the distraction of having someone else with them is too disruptive to their concentration. Having heard the previous information, you may think you now know everything you need to about having orgasms, and you may wonder why you should talk to your doctor about your sex life. We'll get to some of the physical reasons that you might need a doctor's help, but let's address this particular issue here. How many people who know they have to lose weight don't go on a diet and exercise plan until after their doctor orders them to? How many people begin flossing their teeth only because they're following the instructions of their dentist? One could bring up dozens of other examples, such as reducing salt intake, using condoms, stopping tobacco use, and so on. A doctor is an authority figure, and some people need that extra boost of hearing their doctor tell them to do something for their own good before they can motivate themselves to do it. After all, every woman who fakes orgasms whenever she has sex knows that she isn't having orgasms. These women should just tell their partners and figure out what to do. But instead, they prefer to go on faking orgasms. Yet certainly some of these women, if their gynecologists asked about their sex lives, listened to their stories, went over some of this information and handed them a pamphlet, would then take action to start having orgasms. That would be especially true if their doctors asked them about it again at the next visit. When you talk to your doctor about an issue, it changes your perspective on it. You may live with a nagging pain for years, but once you report it to your doctor, you'll take whatever action is needed to get rid of that pain. You'll go for x-rays, you'll undergo physical therapy, or you'll take a pain reliever. If your doctor tells you to do something, you're more likely to listen. So it is with sexual matters. If you could discuss whatever is wrong with your sex life with your gynecologist, the odds increase significantly that you will take action to improve it. But if your doctor doesn't bring it up, and if you don't raise the issue, then that will never happen, and the problem could go on forever. From Dr. Amos's office, talking about sex. Patients rarely, if ever, volunteer to tell their obstetrician/gynecologist, OBGYN, about their sex lives. That's why I make a point of asking my patients about this. Some find it a great relief and open right up, and usually I can help them. Others are shocked and just mumble something like, "It's fine." I can often tell by their responses that it's not fine, but they're simply not willing to discuss it with me. That's okay, but I've also noticed that if I bring it up again, they will sometimes be more likely to open up a bit. Because they don't expect me to ask them about their sex lives, it comes as a bit of a shock the first time, and rather than give me an honest answer, they duck the question. Yet once they know ahead of time that I'm going to ask them this question, then some of these women prepare themselves. Before they get to my office, they go back and forth in their minds as to whether they should say something, and many times they end up giving me at least a partial picture of what's going on. Once the door is open, I can usually offer them some solutions to whatever the problem might be, or refer them to someone else who can. Getting the right information about sex is especially important for pregnant women because of all the misinformation and myths about sex during pregnancy. More about this later. My situation is the opposite of what Dr. Amos faces because people who come to see me expect to talk about their sex lives. Yet that doesn't mean they won't lie. Plenty of women won't reveal that they've been faking orgasms the first time we talk, or at least at the beginning of the session. But I can usually tell what's actually taking place in their bedrooms because their stories don't make sense. I guess that they must be faking orgasms, and then when I confront them, most of the time they let down their defenses. So you see, even when people come to see me because they admit that they have sex problems, they still find it difficult to talk about the details of their sex lives. I'm not trying to provide you with excuses or let you off the hook with these examples. I just want you to understand that it will probably take some effort on your part to talk openly about your sex life with your doctor. Another thing is that the older you are, the harder it is to talk about your sex life. Younger women have become much more open and will discuss their sexual functioning with greater ease with their doctors, or with almost anyone. That's great, because by sharing information, everyone gets to have better sex. This can also put pressure on some people, though. Just because more people are talking about having sex doesn't mean that everyone has a partner with whom to have sex. If all of your girlfriends are going over the nitty-gritty of their sex lives in front of you and you don't have a partner, that will make you feel deficient. But finding a partner is the subject of another book because doctors have enough to do without also becoming matchmakers. Peer pressure can play an even greater role with teenagers. If you're the mother of a teenage girl, you have to be aware that all of the talk about sex will push her into wanting to have sex to keep up with everyone else. A visit to the gynecologist will inject a heavy dose of reality into the picture, and a doctor can be a good ally. Your gynecologist won't tell you what was said during your daughter's appointment, but information will definitely be communicated that will sometimes sink in more deeply than if it comes from you. Tips on how to talk to your doctor about sex. While I've said over and over that you should talk to your gynecologist about sexual issues, I've also admitted that it's...
Sample complete. Ready to continue?